people from saving for retirement. It forces people to lose their jobs, to spend down their savings and sell their car before they can get basic federal food assistance. The process of asset testing itself often deters very vulnerable people, particularly low-income seniors, from participating in SNAP out of a apprehension about sharing their personal information, such as their bank accounts. This provision would create new asset cliffs for workers trying to climb the economic ladder and prevent the state from pursuing options to combat the existing benefit cliffs. At this time, I'm going to turn it over to Kelsey, who's going to cover the mandatory child support cooperation provisions of Senate Bill 17.
Oh, thank you so much, Lisa. Apologies, we had a slide shift there. So thanks so much, Lisa. I wanted to briefly take a moment to cover another really harmful provision within the SNAP world. We got these points, and we wanted to make sure that we communicated from our friends at the Ohio Child Support Enforcement Agency Directors Association. So these folks wanted to share about some of the child support and mandated child support provisions that are included within the bill. You know, we don't have, again, we have a jam-packed schedule, don't have enough time to go through each and every one, but wanted to point out that this bill requires ODJFS to mandate that as a condition of SNAP eligibility, that folks and parents must cooperate with establishing paternity and make sure that they enforce the child support order. Now, on its face, this may not seem like a bad idea. However, we wanted to communicate that this really would be an incredibly costly change for child support enforcement agencies. It would add over 100,000 children to their caseload. And unfortunately, the impact of this statement would be reduced food benefits, or could be reduced food benefits for really hungry children and families across the state. As far as technology, the systems unfortunately do not communicate with each other well. So it would take a lot of infrastructure, a lot of changes for those systems to talk to each other in order to implement this change. And that the cooperation with child support has never been a requirement, especially for non-custodial parents in the child support program. So this is a major change throughout really the system as a whole. And also wanted to point out that establishment of child support does not guarantee that child's going to get the child support payments. So even if the agreement is in place, it doesn't mandate and it isn't going to really change much on to guarantee that those payments are going to come forward. And also we've heard from the proponents of this bill and from the sponsor of this bill that the intent is to eliminate fraud and reduce fraud within the SNAP program. And this child support system and change has nothing to do with that intention and that goal. And lastly, again, wanted to reinforce that this change could take food and reduce SNAP benefits from our needy families and kids around the state, especially during a time of the greatest hunger need and hardship for a lot of families that we've seen in a long time. So very briefly, I wanted to hand it back over to Lisa to really wrap up our SNAP provisions, and then we will hear from our friend Lauren at Medicaid. But Lisa, take it away.
Thank you, Kelsey. And again, this bill is extremely comprehensive. And you're going to hear from presenters now who are going to tell you about other provisions of the bill, but just very briefly, some of the anti-hunger or anti-SNAP provisions that are in this bill are extremely bad for those who are already suffering from hunger and food insecurity. And we need to remember that SNAP benefits are 100% federally funded, and they allow people the ability to purchase a very modest diet with the benefits that are available. This makes no fiscal sense. It makes no moral sense to reject federal food assistance for Ohioans during a public health and an economic crisis. What's more, it makes no fiscal sense to force state and local agencies to spend tens of millions of dollars more on options that almost no other state exercises during government budget shortfalls, no less. We will not be spending more or most of our energy on debating the bill's proponents about the flawed rhetoric of this legislation. But I do want to also keep in mind that SNAP is an entitlement program. The very, very small number of criminal actors that intentionally commit fraud on the system should be prosecuted. No ifs, ands, or buts about it. This bill does nothing to deter widespread fraud because widespread fraud doesn't exist in the SNAP program. The bill would do nothing to protect food assistance for anyone else. Eligible Ohioans are entitled to receive SNAP if they are eligible based on their income and should be able to access the critical food assistance programs. SNAP drives food security. It also has a significant economic benefit to our local communities. Senate Bill 17 would worsen the serious access issues that Ohioans currently face and are already facing as a result of hunger and household income and food insecurity. Ohio can do better than this. Now I'd like to turn it over to Lauren, who will shed some additional light on the harmful impacts of Medicaid that are contained in Senate Bill 17. Lauren?
Thank you very much, Lisa. And thank you, Kelsey, for organizing today's webinar on Senate Bill 17. And thank you all for attending today's webinar. I feel fortunate to not be behind a cat filter. What can I say? So let's dive in a little bit into some of the provisions with Senate Bill 17. If you would like to reach out to me, or if you have questions as a follow-up, or you just would like to talk about Medicaid policy generally, you can find me at the email address that you can see on your screens. You can also follow me on Twitter. I tweet about this stuff pretty often at @LaurenAnthus. So if you are someone who's on social media often, you can find different threads on these topics, linked to resources, that sort of thing. Next slide, please. So, trying to understand the impact of this and reading through the legislation, I think there's sort of a couple different stories that can be told, but before sort of being able to quantify the direct impacts in hard numbers, because it would be pretty pronounced depending on what we're talking about. I thought it'd be good to sort of categorically define how the different provisions related to Medicaid may be felt, or what the impact may be. I sort of have these symbols here that you'll see throughout the rest of the slides that sort of point to what I believe the impacts would be given the provision in question. And it sort of falls along a few different themes. Number one, expense, that it could increase costs to state or local government, either to administer or because it would just mean more activity for the workforce or require more from, say, IT systems in terms of processing and the like. Illegal, essentially doesn't comply with the federal law. There are a lot of sort of preamble provisions, depending on the section that we're talking about, that say things like, unless required by federal law or regulations, the Department of Medicaid, X, Y, and Z. There's going to be a lot in here that the current administration is not going to deem to be allowable, though, at the same time, Medicaid is a state and federal partnership. So, depending on what we're talking about, the federal government may be more amenable to some of these provisions depending on what the state's laws suggest. So where there is no direct federal law, there may be state laws that reinforce moving forward on some of these provisions, even if it's, let's say, contrary to the policy intent of the executive on the federal level. Punishing, just basically creating barriers, making it harder for people to enroll and to sign up in the program. I think one thing about Medicaid is, that, and I said this often before COVID-19, but it's a first responder in public health. If we think about some of our major public health challenges, whether we consider that, the substance use disorder epidemic, or issues like infant and maternal mortality, or COVID-19, Medicaid has played a really important role, both financially and in terms of services. So where we've seen individuals perhaps lose their coverage through an employer, Medicaid has sort of filled in that gap to act as the safety net that it is. By enacting a number of these provisions, not only do we make it harder for individuals to enroll just generally or to have that coverage generally, but it makes it much more complex to maintain eligibility, even if, they would meet all the other guidelines. Essentially, it increases the burden of paperwork and validation that are required of individuals. And when that happens, we see people disenroll. And I tend to think that the biggest impact that this would have is really on kids. If we're thinking about how kids enroll into the Medicaid program, a lot of it depends on what happens with their parents. And we know there's a direct statistical relationship between parents' enrollment and children's enrollment in Medicaid, particularly through the expansion of Medicaid. So if those systems and processes that rely on parents to participate become more difficult and more onerous, we are likely going to see the children's uninsurance rate increase. And then it's really bureaucratic. What's interesting to me is that this legislation is being deliberated before the Government Oversight and Reform Committee. And after this legislation came through, there were a number of bills that were put forward with a very deregulated sort of scope to them. The idea that we need to reduce the number of rules in government, that we need to eliminate a number of regulations for businesses in order to have them be more economically proficient and efficient and viable. And I'm not here to deliberate or suggest what's the best thing commercially in regards to regulations, but I find it curious that the same committee which is describing how regulations act as barriers for businesses feel equally comfortable with increasing many more regulations on individuals, creating many more rules and processes, and relying on government to process paperwork when it comes to people accessing basic health coverage. I just find that to be sort of strange. And so in this way, when I'm talking about bureaucracy, there's a big question of, so how do we get this done? How do we actually implement some of these pieces? Next slide, please. So you'll see here a few things. Number one, there's a lot more in regards to data checks. The legislation requires the state to enter into data matching agreements, to check against lottery winnings, to make sure that individuals have the appropriate income, and that the Ohio Department of Medicaid have a searchable list of individuals with winnings, and that also the Ohio Department of Health must provide a searchable death record list to the department so that people who are dead don't end up enrolled in the program. A few things on this. Number one is that ODM, while it does process eligibility, it's not the institution that does a lot of the eligibility determination on the local level. Also, a lot of these requirements around reporting income are already law. So it just seems to be making more of a political or symbolic statement around individuals who enroll in the program and their sources of income than it does around the reality of that income itself. Also, ODM must check quarterly changes in income, and then on a monthly level, changes in residence. And what's interesting about this is, for many individuals who are enrolled in the Medicaid program beneficiaries, some may be transient. Some may not even have housing whatsoever. I work with an organization locally here called Joseph's Home that works with men who are housing insecure and who have significant behavioral health needs. Their ability to address those behavioral health needs, to get it to a place of stability, to get into housing and also back economically through work is dependent on that coverage, and their residence is Joseph's Home. So what does that mean for Joseph's Home or that individual? Is that now the official residence? How does the paperwork work? Where do they mail these notices? Do they have to do this electronically? Are there opportunities for that electronic portal to be available at places like that? And what happens if you're not in a more stable situation like Joseph's Home? So this idea that you have to increase the number of eligibility checks and income checks really is just about creating barriers, and it's going to be really expensive to do. I think about everything that we've experienced recently in terms of IT systems. We don't even have a centralized sign-up website for vaccines quite yet. Imagine trying to process millions of eligibility claims for Medicaid enrollees. It would take a lot of work. Next slide, please. So eligibility checks. So honing in on this idea a little bit with a bit more specificity. So there must be post-enrollment verification. So if someone does enroll, the state's going to have to verify that this is true. So again, we're talking about more IT, more expense. I don't know if this is legal. If someone has already gone through the eligibility process, why would the state need to check it again? It sort of already hits the system to ensure that people are eligible. Also, this idea that the state cannot conduct presumptive eligibility. The way that it's written, it sounds like it's limiting it to the Medicaid agency, but I think that there's a question around this. If you are an uninsured or underinsured person and you show up at the hospital and you don't have Medicaid currently, you can essentially get care that you need, and the hospital can go through an administrative process, or the FQHC can go through an administrative process, et cetera, to assume that you're eligible, which is really about revenue recapture for institutions. Hundreds of millions of dollars are tied up in this difference between when people show up for care and then the assumption of care. And then the idea is, if there's that assumption, that they follow up with the appropriate paperwork to become eligible, et cetera. And oftentimes that is the case. It's a pretty high turnover rate. So if you suddenly lose that, well, that becomes an economic threat to hospitals, to people who are seeking care, and particularly in this regard to hospitals, what that means is the potential for cost shifting, right? If you suddenly have a stark, steep increase in uncompensated care at institutions, well, they're going to have to make up that money elsewhere, and where that money is going to be made up is in how they contract with employer-sponsored insurance. Also, the state can no longer accept self-attestation. So the idea that people are confirming that they are doing what they need to do to maintain eligibility, that would no longer be allowed, which means that there would be more onerous paperwork requirements. And then the state, interestingly, would seek approval to not exercise current federally enabled abilities around comparing other data relative to income. So you couldn't check the SNAP system, or say WIC, or other sorts of things that may be in this new data lake that the state operates, to ensure that income is matched. Now, I have a question here about the legality, because part of what was included in the ACA was a provision around ex parte determinations, basically meaning if the state has the data available to confirm that someone is eligible for Medicaid, they are required to follow up and make sure that that individual has their income or their eligibility maintained. So does that conflict with federal law? Does that expose the state to a potential lawsuit? And then also to not comply with public notice requirements, which is really interesting, that, when the state might be developing, say, waivers or state plan amendments, that they don't have to notify the public anymore about those changes. That is, I think, a significant concern to folks like, me, policy analysts and the like, but also consumers who should be able to understand what may be changing about the program. Next slide, please. EF-MAP. So, Kelsey had mentioned the very positive beneficial impact of EF-MAP. Now, when that goes away, there's a question of, well, so how does the public health emergency rules that loosened eligibility checks, how does that get reasserted to have people redetermine? There's an idea out there that with the acceptance of federal money, that there has to be some maintenance of effort, or an MOE. So despite the MOE, the state's going to have to conduct redeterminations, going to have to conduct them within 60 days and do an audit that involves all the pieces you see there about the redeterminations that are due, check all the information on eligibility, and develop a report and submit it to the GA. To me, this sounds like you have to do 3.5 million eligibility checks within 60 days. And if people aren't determined because there isn't available information, that means you're going to see broad disenrollment, which would be a significant challenge, I think a legal challenge as well for the state, and really just operationally really expensive. I imagine having to do all that work within 60 days. Basically, the state would be doing nothing else, and I doubt that they could be able to accomplish it within 60 days. Next slide, please. And then finally, the work requirement waiver is something that many of you may be familiar with. Ohio submitted, per the direction of the General Assembly, an 1115 demonstration waiver, which required individuals to conduct certain community engagement activities. While we expect the Biden administration today to rescind the rules that enable these waivers from even happening, this legislation includes a number of provisions which double down on a lot of those policies, which A, means that the state would have to amend its application to the federal government. Likely won't be successful, even if they were deemed to continue this policy as illegal, but also increases the barriers. So it adds parents and caretaker relatives as a category that would apply for work requirements. It adds additional requirements, including raising the age from 55 to 65. Those who would be affected must document 20 hours a week of work in order to qualify for the program, must be at a higher ed institution in terms of the exemption for people who are receiving education, so they can't go through a training program unless it's a designated institution of higher education, must receive a medical certification of unfitness for either a physical health or mental or behavioral health issue. So you have to go to a doctor and be deemed unfit in order to qualify for the program. And then parents of children under 1 are the ones who are exempted. So before, if you had a child, I believe under 5, you were exempted from the program. Now it's only children under 1 or children who are disabled. So only those parents would be deemed exempted from the work requirement. You also must check that eligibility against the marketplace, the ACA marketplace, which is already happening. There is also the prohibition of re-enrollment for 6 months if an individual fails to report any changes in their status. I think one of the challenges here is that's not very practical. The way our eligibility check system works a lot of times on the local level involves mailing information. What does it mean to report? How do you report? Is it through paper copy? Can you do it online? What happens if you're homeless? What happens if you move to a different location? So the failure to report could penalize people depending on what the parameters of that may be. And then it increases redeterminations from an annual scale. So once every year, people have to be redetermined to twice a year. So now the schedule is biannual, which is been shown to depress enrollment, to act as another barrier for folks. Next slide. So I think that's all the details and parts. I'm more than happy to answer any questions. I see a number of questions in the chat, Kelsey. Would it be better to hold these to the end?
That is the plan, Lauren. We have a few more panelists to go through, and then we will get to those questions first at the very, very end. So thank you, Lauren. I really appreciate it. What a great use of symbols.
Thank you.
And then, so Lauren, thanks again. We will go ahead and move forward. So our friend Joel Potts, we know, was on the road back. He actually had a meeting with the bill sponsor, Senator Tim Schaffer, this morning. Hopefully he can join us shortly. But in the meantime, I'm going to ask Zach Schiller from Policy Matters Ohio, he's their research director, to share more about the unemployment insurance changes and how that's going to hurt, especially during this time. So Zach, please take it away when you're ready.
Great, thank you, Kelsey, and I appreciate the opportunity to be here. There's a lot going on with unemployment compensation these days. You just read the newspaper every day. This bill has some really noxious provisions relating to unemployment comp, or UC. They fall into 3 broad categories. It requires a match of new claims versus all kinds of databases, including the DRC's prisoner databases. It goes after overpayments in a really problematic way. And it sets up all kinds of new reporting requirements for the agency as a part of the anti-fraud efforts. And I want to apologize that I don't have any nice slides. I didn't have time to put them together, but bear with me and I'll just have to describe this orally if you can take that, so I don't have the nice symbols that Lauren had, which were so helpful. Basically, the unemployment compensation provisions of this bill, they rest on 3 misconceptions: that there's been an explosion of fraudulent claims that have been paid out of the regular UC program, that that's being paid by Ohio businesses or will be, and that they have had to accept tax increases because of it. The vast bulk of the fraud that has been occurring or attempted in Ohio has been in the Pandemic Unemployment Assistance Program, or PUA, which was a federal program created last year under the CARES Act, specifically for workers who don't ordinarily qualify. Many of them are self-employed. Altogether, through last year, there were 56,761 fake claims paid in PUA, $331 million. And more than half of the 1.4 million PUA claims in Ohio have been flagged for possible fraud. Now, how many will actually turn out to be, we don't know. By comparison, in the regular unemployment program that existed before and will continue, there have been 6,300 fraudulent payments paid out of 2 million that have conclusively involved fraud. So you can see that this is basically has not been an issue in a major way in the regular program compared to the PUA program. And that's because this program did not have the same kind of documentation requirements. By definition, someone who is self-employed does not have an employer that the agency can go and check to see, okay, were you employed for a certain period or how much did you pay? And so this basically allowed some international crime rings to, in Ohio, but also around the country, take advantage of this and unfortunately allow for a lot of fraud that wasn't happening in the regular program. Now, what happened just yesterday, if you've been watching, is that the Department of Job and Family Services announced that there had been a big increase in the number of attempted fraud in the regular UC program. There was, I think, about 3 times as many claims last week, new claims, as there had been, which is very unfortunate because the result of this is going to be that they're going to slow down, not process people's claims who have legitimate claims as quickly to deal with this. However, it's important to note that these are new claims that have not been paid. So while certainly we have to be on the watch for fraud, as you heard earlier, there was 50 times as much paid out in fraudulent PUA claims as there has been in regular unemployment. And yet this bill is going after the regular unemployment system. Moreover, in the most recent act that Congress passed in December, they tightened up the standards for PUA so that states are now required to implement identity verification systems, ask for wage records in a way that they did not previously, which hopefully will mean that it's harder for these crime rings to get into the PUA system. Crucially, Ohio employers are not on the hook to pay taxes for PUA benefits. And so while we certainly don't like to see that fraud, there is no connection between what Ohio employers are paying in taxes and the PUA fraud that has occurred or will occur. And so one shouldn't basically confuse the opportunistic fraud that's been conducted by criminal syndicates with the usual activity of Ohio UC claimants. Unfortunately, and I think this is the worst provision when it comes to unemployment in this bill, it says, and I quote, that the ODJFS director shall, quote, require the recovery of benefit overpayments to the fullest extent permitted under state and federal law, regardless of whether the overpayment resulted from fraudulent misrepresentation or reasons other than fraudulent misrepresentation. So this is basically saying they need to go after people who innocently may have made a mistake as easily or as much as they do the fraudsters. That is really bad news and should not be allowed to become a part of Ohio law. Instead, what we ought to be doing is what 29 other states have done and allowed for overpayments to be waived for equity and good conscience, so that if people are unable to make these payments and they haven't been defrauding the system, we can in fact relieve them of having to make those repayments. And that's what so many other states do and what we ought to do. This bill actually goes in the opposite direction. The bill also calls for a whole variety of ways in which ODJFS has to check on new unemployment claims against various databases. They don't seem to be aware of what the agency already does, because a good deal of what they're proposing here is already something that's in agency practice, to compare the new claims against new hire databases, to look at this new data hub that the National Association of State Workforce Agencies has, the prison databases. So what this does is it kind of locks the agency into the use of specific systems when other better new ones may emerge and then require additional statutory changes. I think the other danger here is that when you adopt these anti-fraud provisions, they may not make it more difficult for fraudsters. And in fact, that's what's happened when it's been looked at in other states, but they make it more difficult for legitimate claimants. And I think this echoes what Lauren was talking about in the Medicaid system. We have thousands upon thousands of Ohioans who have been unable to receive timely payment of their benefits, unemployment benefits, because the department has not come close to meeting the federal standards for how quickly they're supposed to get payments out for ever since the pandemic struck. I think that any additional anti-fraud provisions need to include data collection on how these provisions are affecting claimants who have not committed fraud and how many have been blocked access because of such measures, because all too often that's what we find. The anti-fraud measures don't do a good job in keeping the fraud from happening. What they do is make it harder for legitimate claimants to get the benefits to which they're entitled and desperately need. So I think in short, the UC provisions of this bill are unnecessary and counterproductive. And I'd be happy to answer any questions you may have after the presentations are through. Thanks very much.
Zach, thank you so much. And we know, man, that's all that the headlines across Ohio today is talking about, the fraud. Thank you so much for making that distinction between what we're really seeing happening between the PUA system and traditional unemployment. With that being said, I will go ahead and toss things over to Regina Campbell. She is the managing attorney at the Legal Aid Society of Cincinnati, and she's going to tell us a little bit about what her and her colleagues have been working on in making sure that those legitimate claimants, those folks who do qualify for these programs, who are eligible, you know, it's still already a challenging process to apply for and stay on these programs, and how this bill would make it even worse. Regina, when you're ready, please go ahead and take it away.
Yeah, thanks, Kelsey. So I, like Zach, don't have a pretty presentation. I really just want to talk to you this morning as someone who is currently representing clients and who's supervising lots of other advocates who are representing clients to try and get and keep all of the benefits that are mentioned in this bill. I think that I will probably speak for a lot of people when I say that when I read this bill, the immediate sense of just anger and repulsion, because this bill is clearly written from the perspective that everyone who is seeking public benefits is trying to cheat the system. And it's the system's job not to ensure that people get on benefits, but to ensure that, to make it as hard as possible for people to get on benefits, because then in their logic, the only people that get on are the real people who are eligible. And as Zach was just saying, clearly that is not what is ultimately going to happen here. One of the things that we see constantly in our representation of people who are seeking these benefits is that the verifications that are required are always the highest hurdle that people have to get over to get and keep these benefits. I would say that the vast majority of the intake that we get here in Cincinnati, and I will speak for my legal aid colleagues around the state when I say that I feel confident that this is true for their programs as well. The vast majority of cases that we get are at the verification or at the recertification or renewal part of the process. When people are being asked for verifications of their household, when they're being asked for verifications of their income. Some of the most troubling things in this bill from an advocate's point of view are the change reporting requirement changes. And so one of the ones that jumped out to me, the getting rid of no self-attestation of income or of a change of employment. I cannot tell you how often we rely on that self-attestation. It is a little shocking to me that it's hard for people to understand that when somebody leaves the job, their former employer does not want to take time to fill out a form to say, yes, it's true, this person doesn't work here anymore. Any small business owner, anybody who runs a business is going to be able to say, I can't take the time to fill out that form just to tell you that this person quit and left and doesn't work here anymore. And so without self-attestation, really our clients have no way of proving that they don't work somewhere. How do you prove a negative? Like, I can't show you a lack of a pay stub until it's been a little while. The data matching databases that the counties use to look at whether someone's working, they won't catch up for a while. And so this inability to prove a negative is really a huge hurdle in getting people on and keeping benefits. And so that self-attestation, we work really hard to make it legitimate, to include as much information as possible. And to not have that would be a huge hurdle for people in this verification process. One of the other things that I think that Lisa really talked about in the beginning, this change reporting in SNAP, to go from having to report if your income goes over the gross income test to the anytime it changes of $100 or more. anyone who works with low-income people knows that they are not salaried. They do not get the same paycheck every single week. In fact, I would say that for the vast majority of my clients, a $100 change in their income is a weekly, monthly occurrence. And so, as Lisa said, this would require people to be in constant contact with their Department of Job and Family Services. The other thing too is that when almost everybody gets their pay stubs electronically now. Very few people, or very few of my clients, actually have a paper pay stub. They have to log into Paycor or some of the other large agencies that do payroll for businesses. Once you leave a place or you're fired from a place, guess what? They don't let you have access to that database anymore. And so in order to get pay stubs, to be able to prove anything, to prove that your income's gone down or to prove that your income has made this $100 change, being able to get into that database is a really big deal. They assume that everyone has access to the internet on a constant basis and can get into this. They assume that people can print it out, or they assume that people can do all the things that would require this very constant reporting of changes in their income to the Department of Job and Family Services. Any increase in the touches that people have to have with JFS are absolutely going to increase the amount of churn that we see. And I can speak with a lot of confidence to say that the churn we see, people going off and going on again, they go on again when they become desperate. So if somebody gets off of Medicaid and they're fairly healthy, their kids are fairly healthy, they may not try and get back on Medicaid for a little while. They may do it only when they have a medical crisis. If we wear people down and make it so hard to get and keep back on benefits, there is no doubt in my mind that there are thousands and thousands of people who will voluntarily give up their eligibility for these programs because they just don't want to deal with this system. I would like to propose to these senators that every 6 months, they have to re-sign up for their private health insurance. I want them to have to fill out all the forms that those of us who are lucky enough to have job-associated healthcare that we have to fill out once a year. We all know it's a nightmare. We hate it. We put it off to the last minute. If we had to do it twice a year, we would be complaining like crazy. They are imposing verification requirements and reporting requirements on people that are not expected of anybody else in any other systems when they're getting these benefits. And it's clear that the goal is, they say that it's to root out fraud. I think it's clear to all of us who work in these systems, who study them, who represent people in these systems, the clear goal is to knock people out of these systems. And if you wear people down and you demand so much of them to stay, sorry, I'm right on the street, so I apologize for the siren. The more you demand of people in these systems and to stay in these systems, the fewer and fewer people who are going to participate. We already know how hard it is to convince a lot of people to even get into the system, to get their kids on Medicaid or to get their kids SNAP benefits. There is still a huge stigma to this. And so when you can help somebody and convince somebody to get into this system, that it's worthwhile, if you have to talk to them about this constant reporting, it's degrading to people. It's humiliating to people to have to keep reporting these things, and it's just too much of a burden. All of these changes will undoubtedly make it harder for those of us who are representing clients to keep them on benefits. And I think less people will seek out help from legal aid because they just don't want to have to deal with it. The last thing I just wanted to say, the idea of locking people out of Medicaid for 6 months if they don't timely report a change is one of the most offensive things in here to me. And I really hope that, again, I'd like to turn this around on the legislatures and say, I'm going to lock you out of your private health care if you don't report a change. And so I really do think that where we should be coming from is a focus on, this is going to disproportionately hurt working people. They are the ones who have the most unstable lives, which is completely unfair. Our low wage workers have the most unstable work lives, and all these reporting requirements will be disproportionately on their shoulders. Thanks, Kelsey. I appreciate the time.
Oh, Regina, no, thank you for joining us today and for the work that you and your colleagues do. Just how incredibly important it is, and giving us such a human perspective of the impact of this bill. Thank you so much for joining us. And with that being said, we will move on to our next slide. What can we do to help? What can we do to fight against this bill and make sure that it doesn't move through committee successfully and that we can continue to build the opposition to it? So as of now, I am anxiously looking at my phone to see if we have any update, but to our surprise, this bill is not scheduled for opposition testimony next week. We were fully anticipating and prepared that this bill will be up for an opposition and interested party hearing next week. As of now, the Senate Government Oversight and Reform Committee is scheduled to meet at 2 p.m. on Tuesday to discuss a bill that talks about the authority of the governor to declare public health emergencies and executive orders and such. So that bill has also gained a lot of attention in the legislature. We'll see if this bill gets added to the agenda. If it is, we will make sure that we spread the word. But in the meantime, while we keep our eye to see if anything changes, wanted to encourage you and your organization to sign our opposition letter. We pulled together a letter really trying to convey to the members of this committee, and of which the bill sponsor, Senator Tim Schaffer, sits on, to just tell them, again, the human impact of this bill. We know in times of crisis, we look to our leaders to support those who are really struggling. And this bill does the absolute opposite. It really puts up additional barriers for the help that folks need during these times. So if you feel compelled, we would love to have you join our opposition letter. The link is in the chat. It also will be available on AOF's website, advocatesforOhio'sfuture.org. Also, an opportunity to communicate with the leaders on this committee, as well as Senate President Matt Huffman. We've included all their contact information, their email, and their phone numbers. If you feel compelled to make a phone call, I'm sure they would appreciate hearing your opinion. We'll say that. Also, we are doing a bit of a social media push. We had a Twitter storm active during the proponent hearing that we experienced on Wednesday, and we really made a splash. We are using the hashtag Ohio can do better, hashtag Ohioans against Senate Bill 17, and wanted to really emphasize that the opposition to this bill is really far-reaching. So not just Advocates for Ohio's Future members, but some of our partners. We've had some national organizations catch on and join the fight and really interested in this bill, and wanted to share that this is another way that you can become involved. And if you would like additional resources to either post on social media or talking points, please feel free to contact me at kbergfeld@communitysolutions.com. I'm happy to provide you with the tools necessary to get our point across, to make your voices heard, and we really want to make it as easy as possible to join this fight. We're here for you, and the more voices that we can add, the better, certainly. So we will go ahead and close today's session. I wanted to also allow our friend, we have just maybe one more minute. Lauren, if you're still on the line, we have one question about Medicaid data checking and data matching from our friend Megan Odell. I'm trying to, Lauren, can you explain what data matching agreements aren't currently already in place for the folks still on the line?
Yeah, of course. So, I think there's some detail that you would need to discuss directly with the state. Right now, there's a lot going on in regards to data integration. I think during Director Corcoran's testimony, she had mentioned they have over 100 different interfaces relative to their business processes. So, I think it depends on what part we're talking about. In regards to eligibility, however, the standard really is set by federal law regarding modified adjusted gross income and how that gets calculated. So in the example in the bill around lottery winnings, Ohio already collects taxes on that for the federal government and reports it to the federal government for anybody who has lottery winnings. So that would ping against the IRS system, which is the basis for determinations anyway. So I would say that the main agreement that exists between the state and federal government is through that calculation around income. A lot gets reported to the federal government, even when people, submit their own taxes. So, I would also just point people in the direction that there's a lot of program integrity laws, as we call them, fraud and abuse laws that Ohio has on the books. Ohio, I believe just a couple of years ago, was the #1 state in prosecuting Medicaid related fraud and abuse. And that amount was around, I think, like $4.8 million recovered in 2017, which is about the amount of money Medicaid spends in 90 minutes. So, when we think about the amount of fraud, it's pretty slight. And when we think about where the fraud takes place, it's primarily with providers. It's not with individuals who are, and really it's abuse, not fraud. It's not with individuals who are intentionally, inappropriately enrolling in the program. That's a whole different set of things. So there's some more detail there. I'm more than happy to connect with anybody about some of these laws and the rules and regulations.
Thank you so much, Lauren. We had one more quick question, and then we will sign off for the day. Do stimulus payments count for SNAP asset testing?
No. And I will say that the new $300 PUC that is starting, that people are starting, the pandemic unemployment compensation that used to be $600, that's now $300. There was a change that says also that does not count as income for SNAP. The previous PUC did, which knocked a bunch of people off. New PUC does not count as income, which it didn't under Medicaid before, which is a huge good change for people.
Regina, thank you. I love a resounding answer. I love it. All right, everyone. Thank you so much for your time this morning, still morning. Wanted to let you know we'll be back here on February 26th for another advocacy webinar. This time, hopefully we'll have an update on Senate Bill 17, as well as dive a little bit deeper into that budget proposal. Make sure you follow us on social media, especially Twitter. That's where a lot of the action happens these days, at advocates, the number 4OH. And also make sure you sign up for our weekly newsletter. That will be your first opportunity to sign up for our webinars that we will, again, continue throughout this process. So we want to thank you. I want to thank our panelists today for your time and your effort for really communicating a really technical bill in a comprehensive way. I'm just always amazed and so proud of my membership and leaders for how they make these really dense bills comprehensive. So we can understand and we learn how to help in the best way. Stay safe, everyone. We'll see you in 2 weeks at 10:30, and stay tuned on social media for any changes on Senate Bill 17. Have a great one. Thank you for joining us today.